Assalamualaikum to Madam Ain and my fellow friends. My name is Siti Hazila binti Muhammad Hasim and I'm from SR113-4C. So today I would like to explain more about prevention of bleeding and wound. So let's go. So the first one is taking infection control precaution. So in this case, you must place a barrier between you and the victim's blood because we did not know the history of the patient. Maybe he suffered from HIV, AIDS, and others blood disease. So from the blood, we can get infection. If you can use glove, bandage, face mask, or clean cloth. If you can, this is the other option you can use, which is the victim's own hand. Second is you are strictly avoid from touching your nose, eyes, mouth, or foot while handling the first aid care because you can spread the virus, bacteria, or other disease from your hand. Thirdly, after you finish treating the victims, you must wash your hand with soap or any antiseptic cleanser, even if you wear a glove. Okay? Lastly, you need to wash all the items that have the victim's blood with hot and soapy water. Then you can rinse them well. The next is, in case of severe bleeding, you must follow this step. So the first one is activate the EMS. So what is EMS? EMS is stand for Emergency Medical Services. The next is you must determine the cause and the source of the bleeding and general condition of the victims, whether he or she still conscious or unconscious. Then you must control and stop the bleeding. So in control the bleeding has been explained by Shahrina. Then you should place the victims in the right position where she or he will least loss of blood. Then establish and maintain an open airway so that the victims can breathe, can easy to breathe, get the oxygen. Lastly, after the bleeding is controlled, you must take measures like vital sign every 5 minutes to prevent or control shock. The assessment we do every 15 minutes. Other than that, you must stay alert for the complication of the blood loss. So in this slide is explain about don'ts. So start. The first one is do not pick at a wound to see if the bleeding is stopping, because the less you disturb the wound, the bigger chances to control the bleeding. Second, do not probe a wound or try to pull out embedded object from the wound, because this will cause more bleeding and will be harm to us. Third, do not remove or dressing if it soaked with blood. Instead, you have to add the new one, because if you disturb the wound, it will be more bleeding. Fourth, do not try to clean a large wound. This will cause a heavier bleeding. The last is, do not try to clean the wound after you get the bleeding under control. Instead, you must get medical help to make sure that the bleeding are not severe. Okay, in this slide, we have to seek medical help immediately in several conditions. So the first condition is, if the bleeding can be controlled, it is required to use tourniquet, or it may be caused by the serious injury. So we have to seek medical help immediately. Second, the wounds are too large and deep. Third, gravel and dirt can be removed easily with gentle cleansing. Other than that, you may feel the sign of the infection develop, including increased pain, swelling, redness, and maybe you feel some fever. Then you have to seek medical help immediately if the injury is due to the human or animal bite. Other than that, if the victim is in shock or the victim has bleeding disorder. And the last is, if the victim is taking the blood thinning medication such as aspirin and warfarin. So this slide is explained about prevention of open wound, which is for impact object. The firstly is, never remove an impact object unless it penetrates the cheek or causes a way or chest concern. If the wound is hidden, so you need to remove the clothing of the victims so that the wound will be exposed. Next, manually separate the impact object from any motion. Even the impact object move or have motion, it will increase the bleeding. Next, you can control the bleeding with direct pressure. But bear in mind, do not put pressure on the impact object. Okay? Next, you can use bulky dressing or bandage to stabilize the impact object. Then you have to activate the EMS immediately. Lastly, do not attempt to break off, take off, or do anything to the impact object unless there is no transportation in that place. So the first one is, take a great care of the amputated body part, because it will be determined whether surgeon can reattach it later. We have to take a great care of the amputated body part because the tendency it to reattach are bigger. Generally, you should not to wasting time for searching amputated body part or neglect victim care. But if the amputated body part can be located quickly by the others, so you have to rinse it gently, but do not scrub it. Remember? Then wrap it in a dry, sterile dressing. Next, Place in a cooler or container. The lastly is give it to the EMS when they are arrived, so that they will be transported to the victim.
So the conclusion is it can be concluded that everyone that I have stated, which is it had 6 types of one. So this type of one will be treated with different kind of treatment, depends on how dangerous is this one is. When this one had been treated properly, so it will not affect other person or the person that involved the injury.